Hello everyone. I hope you all are doing well. I am Kushal Saini, a third year medical student, and I would like to tell you about a medical condition in dermatology, hirsutism. Hirsutism is a common condition that causes excessive hair growth on your body. It primarily affects women and females assigned at birth. You may develop coarse, dark thin hair growth on your upper lips, chest, chin, abdomen, thighs, or lower back. It can happen if the androgen hormone level in your body increases or your body is sensitive to these hormones.
Classify the nudism two type: androgenic and non-androgenic. Androgenic caused by androgen hormone, non-androgenic is caused by another factor, but is therapeutically and clinically divided by 8 categories. First category is the nudism of the pituitary origin, and second category is the nudism of the adrenal origin. Third category is the nudism of the ovary origin, and fourth category is continuous nudism, and sixth category is the hepatic nudism. Seventh category is the ectopic production of the hormone, and seventh category is the continue of the failure of the adrenal gland, and eighth category of the failure of the conversion of the androgen to estrogens.
Symptoms of hirsutism. Hirsutism is stiff or dark body hair appearing on the body where women don't commonly have hair, and primarily the face, chest, lower and abdomen, inner thigh and back. People have widely a varying opinion on what's considered excessive. When high androgen level cause hirsutism, and other sign might develop other over time. A process called virilization, and sign of virilization might include depending voice and balding, acne, and increased breast size, and increased muscle mass, and enlargement of the clitoris.
Hello, let us talk about etiology of hirsutism. The cause of hirsutism can be either an increased level of androgens, for example, male hormones, or an oversensitivity of hair follicles to androgens. And the most common cause is polycystic ovary syndrome. Male hormones such as testosterone stimulate hair growth, increase size, and intensify the pigmentation of hair. Other symptoms associated with a high level of male hormones include acne and, depending upon voice, and increased muscle mass. Growing evidence implicates high circulating level of insulin in women to the development of hirsutism. This theory is consistent with the observation that obese women are at the high risk of becoming hirsute. Further treatment that lower insulin level will lead to a reduction in hirsutism. Life-threatening causes include conditions which may result in death or permanent disability within 24 hours if left untreated. There are no known life-threatening causes of hirsutism. Thank you.
Hello, this is Richard Maurya. Let's talk about the pathogenesis of hirsutism. In the pathogenesis, the growth of the sexual hairs is dependent on the presence of androgens. Androgens induce vellus follicles in the sex-specific areas to develop into the terminal hairs, which are larger and more heavily pigmented. Hirsutism is caused by increased androgen production and increased sensitivity of the hair follicles to androgens. In pathogenesis, there is also hyperandrogenism resulting from any factor prolong the anagen, that is growth phase of androgen sensitive hairs, resulting in their conversion from fine light vellus hairs to coarse dark terminal hairs. The response of hair follicles to androgen and other factors such as local 5-alpha reductase activity determines the level of the conversion of hair from the vellus type to terminal hairs.
Growth recommends with the formation of new hair shaft, the reactivation of dermal papillae, thereby replacing the old hair. The hair growth that takes place in months to years to causing the delay of hair growth responding to the changes of the effect of androgen. The DHT is the hormone that acts as a hair follicle to produce terminal hairs. Differences in the activity of DHT explains why the women have the same testosterone levels have different degree of hysterism and or the different diagnosis of hysterism. It especially tells that the high level of insulin production have the concentration of ovarian theca cells to produce androgen. This triggers, and they may also have the effect of high levels of insulin that activate the insulin growth factor 1, that is GHF1 receptor in the same cells, resulting in the formation of increased production of androgen. This is the pathogenesis of hysterism disease.
Risk factors include family history. Several conditions that cause hirsutism include congenital adrenal hyperplasia and polycystic ovary syndrome run in families. And ancestry. Women of Mediterranean, Middle Eastern, and South Asian ancestry are more likely to have more body hair with no identifiable cues than are other women. And obesity. Being obese causes increased androgen production, which can worse hirsutism.
Hirsutism risk factor. Hirsutism often causes women to develop dark coarse hair on the chin, chest, back, upper limbs, and abdomen. This is referred to the male pattern hair growth. While this condition life-threatening, it can be seen an underlying issue that deserve polycystic ovarian syndrome, menopause, high cholesterol, diagnosing hirsutism. Polycystic ovarian syndrome. Polycystic ovarian syndrome is a hormonal condition that causes women to produce too many androgen. Menopause. The menopause ovarian bin window there. Production of hormonal. You get older and this happen the hormonal change that occur lead to abnormal hair growth on face and other area. High cholesterol. High cholesterol is state hormonal that has many effects on the body, and high level of the cholesterol can be cause hair growth in women. Very high level of cholesterol may be indicator of underlying. Diagnosing hirsutism. Examination to check abnormal growth. That's it.
The complications of hirsutism include emotional distress, skin problems, or hormonal imbalance, and increased risk of metabolic disorders. Excessive hair growth can cause skin irritation, ingrows hairs, and acne. Hormonal imbalances that cause hirsutism may also lead to irregular menstrual periods, infertility, and other health problems. Women with hirsutism are also at an increased risk of developing metabolic disorders such as insulin resistance, type 2 diabetes, and obesity. The condition can cause significant emotional distress, leading to anxiety, depression, and a low life self-esteem.
I'm Nandini. Today my topic is complications of hirsutism. Some women feel self-consciousness about having unwanted hair. Some develop depressions. Also, hirsutism doesn't causes physical complications. The underlying causes hormonal imbalance. It also might have polycystic ovary syndrome, which can inhibit fertility. It's also divided into two, that is short-term and long-term complications. In short term, it is obesity, infertility, irregular menses, and acne, acanthosis nigrians. In long term, it causes diabetes mellitus complications and endometrial cancers, hypertension, cardiovascular disease, depressions, sleep apnea, and reduced health related quality of life. And clinical hydros, it's acne potentials marker, and androgens alopecia, it's a poor marker useless with oligomemorrhagia.
Diagnosis and investigations of hirsutism. Diagnosis: blood test to check hormones levels, including testosterone, and ultrasound to examine your ovaries and uterus, and X-rays to evaluate your ovaries and adrenal gland to rule out other conditions. And investigations of hirsutism: first, hormones level, polycystic ovary syndrome, FSH and LH, and adrenals level of 5-DHT is seen, and look for thyroid and look for prolactin. And all these hormonal tests are done in a patient of hirsutism to rule out other cause of hydroandrogenism, and dehydroepi androsterone sulfate, and 17 alpha hydroxygesterone, cortisol and growth hormones, and ultrasonography and CT and MRI of pituitary and adrenal.
So now I will tell you about the treatment of hirsutism. There are three ways. First, we can go with the medication. Medications firstly include oral contraceptives, which can control androgen and progesterone hormone. Second, we will give anti-androgens, and third, we can use topical creams. The other way is we can follow the procedures such as electrolysis and laser therapy. Along with this, we can also make changes in our lifestyle and home remedies, by which we can control hirsutism up to some amount by plucking, shaving, waxing, bleaching, etc. Thank you.
This is Shweta Sundar from 17A. My topic is about prognosis of hirsutism. Hirsutism requires ongoing treatment. None of the treatments make the hair go away completely, but they help make your hair grow more slowly and decreases the amount of unwanted hair. Most people are happy with the result once they find an effective treatment that works for them. Once you find an effective treatment, you may use it a long term. The mortality and morbidity of hirsutism are determined by the underlying causes. Most women with idiopathic hirsutism have no associated mortality and morbidity. On the other extreme, a small number of women may have malignant disease with a grave prognosis.